Before we begin Chapter 1, let's explore some facts and trends regarding the U.S. healthcare system. In her book, An American Sickness, Elizabeth Rosenthal argues that the chief complaint about the U.S. healthcare system is that it offers hugely expensive medical care that doesn't reliably deliver quality results. And to give you a sense of just how expensive healthcare is in the U.S., according to figures from the Kaiser Family Foundation, healthcare costs for families with employer health coverage now exceed the costs of a VW Beetle, as you can see in this graph. In his book, Priced Out, Uwe Reinhardt notes that we now have reached a pass where bestowing on a low-income American even standard medical procedures, such as a coronary bypass or a hip replacement, is the financial equivalent of bestowing on a poor patient a fully loaded Mercedes-Benz. Now, among those individuals with employee-based healthcare coverage, the cost is more than $7,000 for single coverage, or more than $20,000 for a family. So you have to ask, why are premiums so high? When looking at healthcare expenditures as a percentage of GDP, according to CMS, or the Centers for Medicare and Medicaid Services, it comprises 17.9% of the U.S. economy. That's essentially $3.5 trillion in spending on healthcare services, or more than $10,000 per person, according to Jonathan Gruber. And I quote, "Today, the nation devotes almost 18% of GDP to healthcare, which is larger than spending on cars, clothing, food, furniture, housing, fuel, and recreation combined, and is a full 8% above the average in comparable countries." CMS predicts that by the year 2028, the healthcare share of GDP will reach about 19.7%. That means that about $1 in $5 spent in any given year will be spent on healthcare. So we see rising healthcare expenditures in the U.S. largely due to rising spending on hospitals, physicians, and clinics, and prescription drugs, due primarily to rising prices for those services and products, not necessarily higher utilization. This has led to high and rising health insurance premiums and deductibles, and has had effects on households and employers. Let's take a look at these figures graphically, and these are from the Peterson Kaiser Family Foundation Health System Tracker. You will note that on an inflation-adjusted basis per person, spending on hospitals, physicians, clinics, and prescription drugs have all increased over the past few decades. Total national health expenditures now exceeds $10,000 per person per year in real or inflation-adjusted terms. Hospital spending, as you can see by the blue line on this graph, is the largest component, followed by physicians and clinics and prescription drugs. Over the past 3 decades, medical care price inflation has always exceeded the overall consumer price inflation rate. This graph provides a good visual of that comparison. The latest comparisons in 2020 indicates that the medical price inflation continues to exceed the overall consumer price inflation rate. And as depicted in this graph, since December of 1990, the overall price level has nearly doubled, while the medical care price level has more than tripled. And almost every year, hospital prices have increased even more. And as this chart further illustrates, the overall hospital price level is nearly 5 times what it was in December of 1990. Alongside technical change and rising salaries for physicians, one reason for this may be the high and rising market concentration of the hospital sector. For example, limited competition, which allows for the exercise of monopoly pricing and power by hospitals. We will see how these figures are calculated later in the course, but one measure of market concentration shows that hospitals have become fewer and fewer and more powerful in the overall healthcare system. Now, relative to other developed countries, the U.S. is spending much more on healthcare. Its total private per capita spending also outpaces that of many other developed countries. As this visual further illustrates, the U.S. is also an outlier among what is called the Organization for Economic Cooperation and Development, or OECD countries, when it comes to life expectancy and health expenditures. I think simply put, the U.S. is spending much more per capita on health expenditures while trailing other OECD countries on measures such as life expectancy. This chart further indicates the amount being spent on inpatient and outpatient care in the U.S. as compared to other countries such as Austria, Belgium, Canada, France, Germany, the Netherlands, Sweden, Switzerland, and the United Kingdom. Among the most important issues to most citizens, high and rising costs are right up there with the access to health care. And that's because we have 8% of the population, or 26 million people, without any form of health insurance, as illustrated by this chart. With the implementation of the ACA, the number of uninsured had been decreasing. However, it has begun to increase in recent years, as you can see the upward trajectory of this chart. Still, we continue to have disparities in those that are covered by health insurance, and therefore access to health care still remains an issue. And these disparities can continue to be found in race, ethnicity, income, employment, and marital status. These disparities have given rise to demands for healthcare reform, whether that means expansion of public health insurance, such as Medicare or Medicaid, the expansion of health tax credits for the purchase of private health insurance through health marketplaces, or a national health plan, such as a Medicare for All program. So as you can see, there are many variables that impact how the industry functions, and we will be taking a deeper dive into some of these issues as we navigate the course. I hope that this at least has set the stage and given you some insight as to what the challenges are as we move forward in the course. And here ends the presentation.